Today we're talking about urine albumin to creatinine ratio, or uACR, and how it fits into kidney screening in patients with type 2 diabetes. Let's walk through what uACR is, how it's ordered, how it differs from other tests, and how it ties into the quality measures you're accountable for. First, what is uACR? A uACR measure estimates the amount of albumin, a protein, in the urine relative to creatinine, a waste product, over the last 24 hours in a urine sample. Normally, virtually no albumin is excreted in the urine. Albumin in the urine signals that the kidney's filtering barrier is becoming leaky, whereas creatinine reflects muscle waste product excretion and normal kidney filtration. Because the ratio corrects for urine concentration, uACR is more reliable than simply measuring urine albumin alone. You may have heard the term microalbumin, which is an older term. Over time, this term has become synonymous with a urine albumin test. Microalbumin is not a separate test. The term microalbumin actually refers to small levels of albumin in the urine, or microalbuminuria. The uACR calculation is the urine albumin in milligrams per deciliter divided by the urine creatinine in grams per deciliter, resulting in a ratio in milligrams to grams. Clinicians must order both a quantitative urine albumin and a urine creatinine on the same sample of urine for the lab to compute the ratio of urine albumin to urine creatinine, or uACR. If you only order a urine albumin, or only a urine creatinine, without the paired measurement, the lab cannot report the uACR. How do you interpret the uACR result? If it's less than 30 milligrams per gram, that's considered normal to mildly increased. The patient's kidneys are filtering well. This category is called A1. A result between 30 and 299 is consistent with moderately increased albuminuria, or A2, what we used to call microalbuminuria, and requires treatment. Results of 300 or more indicate severely increased albuminuria, or A3, what we used to call macroalbuminuria. This can indicate serious damage, and that may mean a nephrology referral in addition to treatment is appropriate. There can be variability, up to 20%, between specimens, so the ADA standards of care recommend repeating the measurement within 3 to 6 months before diagnosing a patient with moderately or severely increased albuminuria, A2 or A3. The higher a patient's uACR is, the higher their risk is for progression to kidney failure and cardiovascular events. Albuminuria is the earliest sign of kidney disease and the stage where progress can be prevented. Now let's compare two performance measures. The Kidney Health Evaluation for Patients with Diabetes, or KED measure from the National Committee for Quality Assurance, or NCQA, is a HEDIS measure that evaluates adults aged 18 to 85 years old with diabetes, both type 1 and type 2, as to whether they have received both a serum estimated glomerular filtration rate, or eGFR measurement, and a urine albumin to creatinine ratio measurement during the measurement year. This is a process measurement which measures whether patients have had the test performed, not whether the results of the test are normal or not. These tests may occur on the same or different dates of service, as long as they are during the same measurement year. The uACR can be identified in one of two ways: by a single uACR order, or by a quantitative urine albumin test and a urine creatinine test performed within 4 days of each other. Like the KED HEDIS measure, the Michigan Collaborative for Type 2 Diabetes, MCT2D, uACR performance measure is also a process measure and also evaluates adults aged 18 to 85 years old, but we are specifically looking at individuals with type 2 diabetes. The MCT2D performance measure is also a process measure. It does not look at the result of the test. However, in contrast to the HEDIS measure, the MCT2D uACR performance measure focuses only on uACR. It does not look for an eGFR. It only looks at a subset of patients with BCBSM, BCN, BCBSMA, or BCNA insurance due to data availability, and it uses a 14-month performance period rather than a 12-month period to allow for a 2-month buffer getting patients in for follow-up appointments. So in short, the KED HEDIS measure looks at both uACR and eGFR over a 12-month period in a broad diabetes population, while the MCT2D uACR measure looks at uACR screening only over a 14-month period in a defined type 2 diabetes population. So what are the goal rates for the MCT2D uACR performance measure? For primary care practices, the goal is a 10% absolute improvement from the practice's baseline uACR screening rate up to a rate of 90%. For example, for a practice with a baseline rate of 54.5%, their goal rate is 64.5%. For a practice with a baseline rate between 80 to 90%, they only need to improve to 90%. Practices with a baseline rate greater than 90% are asked to repeat a rate of at least 90% during the measurement year. For nephrology practices, the goal is a 5% absolute improvement from the practice's baseline uACR screening rate up to a rate of 90%. For example, for a practice with a baseline rate of 54.5%, their goal rate is 59.5%. For a practice with a baseline rate between 85 and 90%, they only need to improve to 90%. Practices with a baseline rate greater than 90% are asked to repeat a rate of at least 90% during the measurement year. To sum up, if your practice requires you to order separate urine albumin and urine creatinine tests, make sure you order both so you can calculate the uACR ratio and that you are doing this within 4 days of each other. Know that both a uACR and eGFR are required within the same measurement year for HEDIS, while only uACR is required for MCT2D. Be aware that the MCT2D uACR measure differs from the KED HEDIS measure in population and focus. Kidney measurement is important. The reason to get the test done: early detection of albuminuria means earlier intervention and better kidney outcomes in your patients with type 2 diabetes. Thank you for being a part of MCT2D, and thank you for everything that you do to keep your patients healthy.